It's 5 of 11. We should be wrapping up, but I actually will ask the audience, does anyone have any questions for any of the prior speakers? If you do, please come up to the microphone and we'll direct your question appropriately. Okay, one, Bob Montgomery.
So, question about pregnant women. Since their blood volume expands by 50%, that means if their coagulation factor concentration remains constant, there's a 50% increase in factors. How does that weigh into the question of anticoagulation?
No, you think you should, here. Yeah, I think you should come back up to the podium. Yeah.
A lot of work. So excellent question. I think what's also interesting, though, is, of course, there's going to be similar decrements in your other proteins, ones that are important for fibrinolysis and ones that are important for anticoagulation. And for VTE, at least, the risk of thromboembolism during pregnancy may be very much mechanically based. So what we see in the non-pregnant population is that it's a 55-45 split left leg, right leg. In the pregnant population, no matter how early on really you are in pregnancy, you see, but increasing as pregnancy goes along, you see a preponderance for the left leg up to 90%, 10%. And that's because of increased compression of the left iliac vein by the right iliac artery. So what that suggests to me is, at least in that setting, that maybe the concentration of your clotting factors is not as important as maybe mechanical factors. For mechanical valves, I think that's a whole different kettle of fish. I think part of the issue is that we've never gotten it into our heads very well, that when we use warfarin for mechanical valves, we use a higher intensity than we do for other indications, and that when we went into dosing for mechanical valves in the pregnant population, we actually used which was a very standard dose for VTE. And probably is just we need to inhibit contact activation on those valves, and that we probably need a higher dose of low molecular weight heparin or warfarin to do that effectively.
Very good. Thank you. Yes, sir.
This is for Kim. The question basically is the registry the correct way to go about looking at the question with hydroxyurea? I know we talked about this 5 years ago, but should we not at this point in time be getting the feds to fund a study looking at both hydroxyurea and prophylactic transfusion and the comparison of the two with a control group?
I like that design, that study design. I think that you're exactly right. I think that there are questions that, particularly as it weighs head to head with transfusion, need to be answered. And that type of clinical trial needs to be done in the sickle cell population. However, I do think that there's incredible information that we can get from registries. I think that we have to figure out in some way whether or not there's subpopulations and risk associated with a subpopulation of women with sickle cell disease who go through pregnancy and have more complications. So I think that the answer I'm going to give is both, because I think that both can be very beneficial.
Yeah, good question. Anything else? Any other questions for any of the speakers? Okay. Oh, I'm sorry. Anne-Marie has a question.
Kim and Shannon, you are definitely coming back. Because we just checked with the ARS technician, and in both of your instances, the machine, the software, was comparing itself pre-test to pre-test. It didn't do, yeah.
There you go. Yay.
So we have the real data. They're embedded in there. We'll have to just send it all out. We'll certainly send it to the faculty. And if anybody wants to know, we'll let you know. Because we're mortified.
That sure looks
Those
suspicious.
aren't good metrics to present to our, people who look to us for improvement in knowledge and practice. Okay.
Thank you very much for that clarification. And with that, I know that Andy would like the final word, but my penultimate final word is that this has been a real treat for me. I want to thank all of the speakers who really went above and beyond and gave us some really great information here today on women and girls with blood disorders. And it was a pleasure for me to co-chair this event. And I want to thank all of you who, without a break, have actually stayed in this room for 4 hours listening to every single word of this. So thank you for your dedication and stamina. Andy?
And I'd like to thank our sponsors, the Hemostasis Center of Western Pennsylvania, CSL Behring, who gave us unrestricted grants to help support this, and Novo, who gave us a specific grant to help support a portion of this program. Thank them. Thank you. See you next year.